My name is Maurice Nahabedian. I'm a board-certified plastic surgeon at the National Center for Plastic Surgery. My practice is located in McLean, Virginia, but I operate throughout a variety of Northern Virginia hospitals. My practice is really focused on breast surgery. So after a mastectomy, we could place an implant in a couple of different areas. The first area is to place these implants above the pectoral muscle. So the pectoral muscle is the muscle that's on your chest that allows you to contract that. Now, the breast sits on top of that, so the implant or the tissue expander will sit on top of that muscle. The other way to do it, which would be to place the implant or the tissue expander under the muscle. The advantages of putting an implant or an expander on top of the muscle is that we don't have to disrupt that muscle function. So there are several incisions for breast reconstruction, and this would really be based on whether or not we're going to save the nipple-areolar complex or remove the nipple-areolar complex. So if we're going to remove the nipple, then the most common incision is going to be an inframammary. In other words, it's an incision that's just going to be under the breast. Now, another option instead of that would be a lateral breast incision that would come above or below the areola, and that way we could access the breast, do our reconstruction. Now, if the nipple is going to be removed, then the most common approach is usually going to be an oblique elliptical. It's almost like a football-shaped incision that's over the apex of the breast, and that way everything can be removed and we can then commence with the reconstruction. The other way to do it is a vertically oriented or even an inverted T pattern where we would remove the breast and then do our reconstruction with either a tissue expander or an implant. Not every patient is a candidate for nipple sparing. I would love to do nipple sparing on all patients, but if the breast is too large, then saving the nipple may result in complications because the blood supply gets compromised if the breast is too large. So we have to really make sure that we are doing nipple sparing on properly selected patients. So one of the common things that we're doing now would be to use an implant and then also add some fat. The reason why we would add that fat is to increase the thickness of the mastectomy skin. Sometimes it can be very thin and that implant may actually show some of its outline. So what we do is we can camouflage that by increasing the thickness by adding fat. We usually do that at a second stage. We don't usually do that at the time of the mastectomy, but the results are actually very good. So the way that we would actually get the fat is we would pick a spot on your body. Maybe it's the stomach area or maybe it's the hips where you have unwanted fat. We could actually suction that fat out using standard liposuction techniques. We would then cleanse the fat, kind of wash it, and prepare it for re-injection. And once we've re-injected it, then we can really optimize the contour, we can enhance the projection, and we can really get that look that you're asking for.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants. Although rates are not well defined, some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, example lupus and scleroderma, a weakened immune system, example taking medications to decrease the body's immune response, planned chemotherapy or radiation therapy following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to breast tissue, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.